you very much, Nils. Thank you all for coming. Thank you, Jeff and Gary, for participating. Guests, distinguished visitors, I'm here to present to you, if I may have the copy, I'm not supposed to forget your props, to present to you the launch of the report, Public Choices, Private Decisions, Sexual and Reproductive Health and the Millennium Development Goals. This report seeks to give clarity to a discussion that is frequently confused and politicized, and lay out the evidentiary base that has led the world's leaders to recognize that universal access to reproductive health is vital to the attainment not only of the health MDGs, but other MDGs as well. When we talk about sexual and reproductive health, let's also demystify this. We're talking about a set of basic interventions. These include access to voluntary family planning, to safe motherhood, including emergency obstetric care, to efforts to combat sexually transmitted infections, including HIV/AIDS, to actions against harmful traditional practices, including gender-based violence, early marriage, female genital cutting, access to services for post-abortion care, and access to safe abortion when not prohibited by law. This cluster and complex of activities runs through the Millennium Development Goals. Some have said that sexual and reproductive health are not within the Millennium Development Goals. They are core to many of them. They are linked to progress and outcomes in all of them. Let me just cite some examples for you. The master goal of the Millennium Development Goals is the elimination of extreme poverty and reduction of hunger. Poor families are less able to invest in the education and health care of their children, perpetuating an intergenerational cycle of continued poverty. Addressing the stated desires for spacing and limiting families could reduce fertility rates to levels consistent with people's desires and create the opportunity for a demographic bonus, as societies are not, as Edmund Wilson said, on a constant demographic treadmill to keep up with growing younger age populations, but are addressing then populations with larger proportions in the productive years. When this is the case, with a proper policy framework, with investments to create employment, with investments to ensure that there are quality schools and quality health care, social and economic development can be rapidly increased. Education effects are also strong. The enrollment of girls in school depends to a substantial extent on when and whether they are withdrawn from school to help with such things as the daily burden of childcare. High levels of unintended and unwanted fertility accelerate the removal of young girls from school, girls who sometimes have to drop out of school if they get pregnant while they are still in their late primary or secondary school ages, and can impact the future human capital in these countries. Gender equality critically depends on women's ability to exercise control over the number, timing, and spacing of their children. Child mortality is influenced by birth spacing. We know that short birth spacing of less than 24 months has 2 times higher a rate of infant mortality than to the period above that. There is evidence from surveys now that increasing interbirth intervals to 36 months could reduce infant mortality by 24% and child mortality by up to 32%. This can contribute to preventing 3 million unnecessary child deaths a year. Maternal health, maternal mortality is also critically related to the availability of both family planning and to emergency obstetric care. Family planning to ensure that women are exposed only to pregnancies that they choose to have so that the repeated exposure to risks of any single pregnancy are reduced, emergency obstetric care to see that the risks of any single pregnancy are driven down as low as possible. The HIV/AIDS pandemic vitally depends on the availability of sexual and reproductive health information and services. More than 80% of HIV/AIDS transmission is sexual transmission. The integration of prevention programs as part of a strong continuum of effort to address the pandemic will be vital to the reduction and elimination of this scourge. Environmental sustainability depends on moderating the rate of global population growth while we improve the technologies of consumption and production to reduce the level of damage to the planet and the ecosystem. Extending the time between generations by starting family formation later and better spacing births can reduce the overall inherent population momentum and give more time for the larger social adjustments that need to be made. Partnerships for global advancement in the area of sexual and reproductive health have been part of the story for 30 years. Donors have been generous in funding sexual and reproductive health programs. Developing countries themselves are dedicating larger amounts of money to their continuity and their incorporation in their health systems. So we know that this is essential to meet the MDGs. What are the major recommendations of the report? The World Summit last year called on all countries to put together national development strategies that are oriented towards attaining the MDGs. These situation analyses, these phasings and scalings up of programs must include sexual and reproductive health. It will be important in doing this to see that efforts are made to ensure that the information and services meet those who have been most neglected in the past. These services need to be integrated into strengthened health systems with appropriate human resources for health, both medical personnel, paramedical personnel, and community workers, and with appropriate levels of supervision and monitoring. Data is needed to keep careful track and hold people accountable for the progress that's made in this area, and the process needs to be participatory and inclusive. There are no single solutions. They have to be tailored to national contexts, to national beliefs, to national public health situations and requirements. The report also recommends that special attention be given to populations in particular need. It identifies several of them. One of the lead ones is adolescents. They constitute 20% of the world's population in developing countries. They enter adolescence but once, and the choices that they make early on have profound consequences for the rest of their lives. The unmet need for family planning, the proportion of young people who want to not have a birth immediately, is 2 to 4 times higher in young people than it is in the general population as a whole. The biological and social risks to young people of unsafe sex are even higher than they are in the rest of the population. Postpartum women are very frequently underserved by health systems, and this is an instance and opportunity where their willingness and openness to consider the spacing of their next child, should they want one, or what they will do to not have another if they don't, can be critically addressed. People in humanitarian crises have needs that must be urgently met, and none of this goes forward unless special attention is given as well to meeting the needs of and recruiting the partnership of men in the advance of sexual and reproductive health. These are the main conclusions of the report, and I am pleased to present them to you. Thank you.
I'm going to sit here to introduce our next speaker, who needs virtually no introduction to this particular audience. Jeffrey Sachs is the director of the Earth Institute at Columbia University, Quetelet Professor of Sustainable Development and Professor of Health Policy and Management. He has been a leader for decades in issues of health economics and global health, and has, for the past 5 or 6 years, been director of the UN Millennium Project and special advisor to United Nations Secretary General Kofi Annan on the Millennium Development Goals.